It's the final few minutes, and you're actually going to hear from someone else. Um, the as I mentioned, our conference is really the product of a mental health consulting group that we have here at the University of Michigan. Workplace Mental Health Solutions is the name, and there are two co-directors, and I'm pleased to introduce Dr. Michelle Riba, one of the most distinguished psychiatrists in our department, who is also co-director of the Workplace Mental Health Solutions, to make some closing remarks. Michelle.
Well, thanks so much, Sagar. And this has been, I think, one of the most exciting and helpful conferences that we've had over the last 5 years. So really, you were great. All the speakers, all the presenters, and all the participants with the great questions and answers. So thank you so much. When we started the Workplace Mental Health Solutions about 10 years ago, it felt like we were trying to convince employers and managers that workplace mental health was important. And we did try to take a return on investment, a financial way of thinking about things to them, in the hopes of them trying to have a workplace mental health program. And we looked at absenteeism and presenteeism and looking at pharmacy data. It was interesting about the pharmacy data because there were large costs for antidepressant medication and anxiolytic anti-anxiety medications. And one might think that that was good, that patients, employees were being given these medicines. But the question, I think, as Sagar was asking, were people really getting better? Was depression and anxiety really being treated? And one of the problems that we looked at when we looked at the pharmacy data was that the prescriptions were being prescribed, but many of the people weren't taking the medications. Also, they weren't getting psychotherapy benefits through their EAPs or through private groups, so that they weren't getting evidence-based treatment, that is psychotherapy and pharmacotherapy. We were also looking at substance abuse or substance misuse data and the tolls that was taking on employees and the companies and families. So, and that was about 10 years ago. And now we come to today, where I think more and more from the presentations today and the participants' comments, that companies realize that people do better and that the culture does better and communities do better when people are healthier, both physically and mentally. As many of you know who have been with us on this journey through these conferences, and have been active with us in our mental health solutions program, we've gone from the conversation of trying to convince to working together with regional, national, university, business, insurers, to share recommendations, and that's what we've heard today. In addition, we've been looking at mental health, not just depression and anxiety, but substance misuse and trauma and other psychiatric conditions. And then looking to the future, what innovations are out there and what can we be part of? We learned a lot in the last couple of years that workplace forms an important social support for employees and the community, whether that's at a construction site, at the kitchen table, in an office building, or a combination, and how the leadership, managers, and employees can create an environment that is holistic and encourages people to stay healthy. In my own patient care experiences here at the University of Michigan and at the Depression Center, I've seen more and more outreach from employers and managers how to talk to their employees about mental health. People have been scared about doing that, and we're seeing more and more communication. And then how to monitor and support employees as they come back to work from a mental health problem. So that's been great. Another aspect has been that that, sorry. Another aspect has been that we're seeing more and more people with medical conditions such as rheumatological problems, diabetes, who have concurrent psychiatric conditions, want to get back to work early. They don't want to go on disability. And that's really because we're seeing more and more treatments for these diseases and a realization that they want to keep their insurance and that they can live a healthy and productive life by returning to work. So they're looking for assistance from all of us on how to get back to work with both medical and psychiatric conditions. And that's been great. And it also reinforces the importance of workplace mental health solutions to help those employees and those employers keep those people in work. So thank you so much to Sagar, to Danielle, to our speakers, to our planning committee, to our participants here, and to all of those of you who attended this conference today. And I hope you'll fill out the evaluation forms to give us some data about this conference and what we should be thinking about during the year and next year's conference. So let me turn this over to Sagar and really appreciate all of you attending today.
Thank you, Michelle. And you've really outlined some of the challenges for the future and the integration of physical health and mental health. And of course, you've emphasized something that we haven't talked about, but good work is good medicine. If we have a good workplace, that's good for our physical health and it's good for our mental health. I wanted to just close by just a couple of reminders and acknowledgements. First of all, you will get handouts or summaries of the slides. They will be you will get a link for that. You will get other resources. You will get a message about recordings at a later stage. It takes us a while to get all the recordings in order. So that's coming. As Michelle mentioned, you'll also get a request to fill out an evaluation form. That will do wonders for my mental health if you're actually able to fill it out. Regardless of what you say, I got a thick skin. You can give me your best shot, but at least communicate with us. We would really appreciate that. On the planning committee, I don't have the time to acknowledge every single member, but I would like to acknowledge not only the tremendous efforts of Daniel Tobman as the co-chair of this conference, but I also wanted to acknowledge the other organizations. So first of all, this conference is sponsored by the Eisenberg Family Depression Center. We have some key partners at the University of Michigan, the Center for Occupational Health and Safety Engineering, the Center for Positive Organizations, and on our planning committee, we had great input from the National Alliance on Mental Illness, from the APA Foundation, from the Detroit Regional Chamber, and the Great Lakes Regional Mental Health Partnership. And it was really wonderful to have help from all of these organizations and individuals. So thank you. It is time. Get out there, have some chocolate, and have some fun. Goodbye.